Have you ever felt the weight of uncertainty pressing down on your shoulders? The quiet fear that something beyond your control could shift your life in an instant? Hospital visits can feel like stepping into a world where you are both vulnerable and observant, where each beep of a machine or the rustle of a nurse's uniform reminds you of your fragility. For patients with chronic kidney disease, this experience carries an added layer of complexity, a silent tension that few outside of healthcare fully understand. It is not just the illness itself that challenges the human spirit. It is the intersection of medical interventions, environmental pressures, and personal awareness. Every IV drip, every scan, and every medication has its place. But in that intricate dance, your kidneys, those vital organs quietly sustaining life, can sometimes bear the hidden consequences. Understanding this, and choosing to take informed action, is not merely about survival. It is about reclaiming a sense of agency in a space that often feels dictated by others. Dr. Mathew R. Weir has long emphasized that knowledge is a form of empowerment, that patients who understand the intricacies of their own health are better equipped to advocate for themselves. This philosophy extends beyond mere medical compliance. It is a call to cultivate mindfulness in every choice, to observe the signals your body sends, and to insist on clarity when decisions are being made on your behalf. There is a profound beauty in this awareness, a philosophical reminder that while we may not control every circumstance, we can influence our response, shaping outcomes with vigilance and intentionality. Imagine the hospital, not as a place of passive submission, but as a realm where informed action becomes an act of courage, where understanding IV contrast, medications, and fluid management transforms potential vulnerability into conscious stewardship. Every patient has the capacity to notice the subtle ways in which care can affect the kidneys, to question practices that may unintentionally impose risk, and to engage in meaningful dialogue with the healthcare team. It is in this deliberate attention that true empowerment arises, echoing the wisdom shared by Dr. Mathew R. Weir, that informed patients are partners in their own healing journey. Recognizing risk does not mean succumbing to fear. It means cultivating preparedness, anticipating challenges, and maintaining hope even in situations that feel intimidating. And yet, it is often the unseen threats that weigh heaviest. A mismanaged fluid balance, an overlooked interaction between medications, or an unexamined dependency on procedures that might temporarily alleviate one issue while quietly stressing another. In these moments, suspense is not merely a literary device. It is the lived reality of patients navigating the complexities of care. Awareness becomes your greatest ally, a shield fashioned from questions, observations, and the courage to speak up. With every step, every decision, the potential to preserve kidney function lies in the intersection of mindfulness and action, where philosophical reflection meets practical vigilance. This awareness invites a deeper engagement with one's own life, transforming hospital visits from passive experiences into arenas of intentional participation. In this way, what may initially feel like vulnerability becomes a teacher, guiding each patient to recognize that even within the structured protocols of modern medicine, there exists space for personal agency, self-advocacy, and the quiet yet profound cultivation of resilience. Through these practices, inspired by the teachings of Dr. Mathew R. Weir, one can find not only protection for the kidneys, but also a renewed sense of purpose, a philosophical understanding that caring for the body is inseparable from nurturing the mind and spirit, even amidst the uncertainty and tension of hospital environments. The journey towards safeguarding kidney health is, therefore, not simply a clinical endeavor. It is a testament to human intentionality, a reflection of the capacity to confront fear, embrace knowledge, and act decisively to protect what is most vital within us. As you continue through the journey of managing chronic kidney disease, you begin to realize that the challenges are not always visible, nor are they always immediately apparent. There is a subtle tension that exists in every hospital room, an invisible web of factors that can influence the well-being of your kidneys, even when everything seems routine. Every decision, every intervention, carries weight. The contrast used in imaging tests, the timing of medications, the balance of fluids, all of these can silently tip the scales toward risk or protection. The danger is rarely dramatic or instantaneous. It is cumulative, a quiet erosion that unfolds over time if left unobserved. It is here, in this delicate interplay, that the teachings of Dr. Mathew R. Weir become profoundly relevant. He emphasizes that awareness is not passive observation, it is active engagement. It is understanding that your voice matters, that your questions, concerns, and insistence on clarity are essential tools in preserving kidney health. The suspense arises in moments when the ordinary becomes uncertain, when a nurse prepares an IV, when a doctor adjusts a dose, or when a machine signals an alert. There is a pause that seems insignificant, yet carries immense consequence. In these moments, your awareness transforms from simple knowledge to vigilant presence, and you begin to recognize that the power to influence outcomes lies within your capacity to observe, inquire, and assert your understanding. Many patients underestimate this power, assuming that hospital protocols are infallible or that their own role is secondary. Yet, it is precisely this assumption that can leave kidneys vulnerable, unprotected, and over time, compromised. The philosophical truth here is that vulnerability is not weakness. It is an opportunity to exercise discernment, to engage with life fully, and to insist on care that honors the value of your body. There is suspense not merely in the mechanics of treatment, but in the potential consequences of inattention, the subtle danger that might go unnoticed if one does not actively participate in the process of care. Dr. Mathew R. Weir's teachings remind us that knowledge is empowerment, and empowerment is the antidote to passive vulnerability. By understanding the factors that may strain the kidneys, be it medications that require adjustment, procedures that carry hidden risks, or fluid mismanagement that seems minor but compounds over time, patients gain the ability to act with precision, awareness, and confidence. This is a profound shift, moving from being a passive recipient of care to an active partner in the healing process. And yet, the suspense of uncertainty continues to weave itself into each moment, challenging patience and demanding vigilance. It is not fear but conscious attention that transforms these moments into opportunities for protection and resilience. Consider the quiet intensity of a hospital day, the routine of monitoring vital signs, the subtle differences in lab results, the moments when a caregiver hesitates before administering a treatment. Each is a pivot point, a chance to intervene with insight, guided by understanding and careful observation. It is in these subtle, almost imperceptible moments that the patient's engagement can be life-changing. Awareness, in this sense, becomes an art form, a philosophical exercise of attentiveness, foresight, and responsibility. The suspense is not external drama. It is the internal challenge to remain vigilant, to perceive the invisible forces that might endanger the kidneys, and to act before harm can occur. It is a practice of mindfulness married to medical literacy, of courage intertwined with discernment. Inspired by Dr. Mathew R. Weir, one comes to recognize that the seemingly ordinary acts, asking questions about medication timing, verifying fluid balance, understanding the implications of contrast scans, are not trivial. They are acts of profound empowerment, shaping the trajectory of kidney health with each intentional choice. The suspense in this journey is not a source of fear, but a catalyst for engagement. It awakens the patient to the depth of their own agency and the significance of informed action. By embracing this perspective, every hospital visit transforms from a moment of passive endurance into an arena of conscious participation, a space where the patient's insight, awareness, and philosophical reflection intersect with the science of medicine to protect what is most vital. Through this engagement, inspired by the principles Dr. Mathew R. Weir teaches, patients discover that the preservation of kidney health is inseparable from the cultivation of self-awareness, intentionality, and the courage to act even amidst uncertainty. Suspense, then, is not the enemy. It is the teacher, reminding each patient that life's most critical battles are often quiet, subtle, and winnable through knowledge, awareness, and steadfast vigilance. As the journey of understanding kidney health deepens, one begins to see that true empowerment lies not only in knowledge, but in consistent, conscious action. The lessons of chronic kidney disease extend far beyond the walls of a hospital room. They echo through everyday choices, habits, and the way we engage with our own bodies. Each decision carries significance: what we eat, how we hydrate, the diligence with which we monitor lab results, and the courage to question treatments that may affect our kidneys. It is here, in this intersection of science and personal responsibility, that the teachings of Dr. Mathew R. Weir resonate most profoundly. He reminds us that patients who actively participate in their care do not merely survive, they thrive, cultivating resilience and mastery over circumstances that often feel beyond their control. This is not a call to anxiety, but a philosophy of deliberate engagement, a mindset that transforms the unseen dangers of medical care into opportunities for awareness and strength. Every hospital visit, every medical decision, is a test of attentiveness and preparedness, but it is also a chance to assert agency and protect what is vital. The story of kidney health is, at its core, a story of human intentionality, recognizing risks, embracing knowledge, and applying it with clarity and courage. Suspense and uncertainty may linger, but they do not define the journey. Rather, they illuminate the critical moments when mindfulness and proactive action matter most. By understanding the potential hidden dangers, such as IV contrast that may strain the kidneys, medications that require careful adjustment, or fluid imbalances that can quietly accumulate, patients gain the tools to transform vulnerability into empowerment. There is a philosophical beauty in this transformation, a reminder that our bodies are not passive vessels, but active participants in our own health. Engaging with this perspective encourages reflection, patience, and careful observation. It calls upon each individual to see themselves as both guardian and steward of their own well-being, to balance trust in medical expertise with an unwavering commitment to understanding every intervention. Dr. Mathew R. Weir's guidance underscores the importance of this balance, teaching that awareness and self-advocacy are not merely practical necessities, but moral and philosophical imperatives. To honor one's own life, to protect the organs that sustain it, and to cultivate the wisdom to act decisively when necessary. This understanding also transforms fear into purpose. The suspense and uncertainty that once seemed daunting now become catalysts for engagement, motivation, and personal growth. Every subtle decision, the timing of a treatment, the questioning of a procedure, the attention to lab results, is a declaration that one's health matters, that kidneys, and indeed the entire body, deserve deliberate care. By embracing this mindset, inspired by Dr. Mathew R. Weir, patients are not passive observers, but empowered participants, shaping outcomes through vigilance, mindfulness, and informed action. Life, after all, is full of uncertainties, and the greatest victories often occur in quiet, invisible ways. Through daily choices, consistent awareness, and the courage to act in alignment with knowledge and principle. Protecting your kidneys during hospital visits is more than a clinical goal. It is an embodiment of personal responsibility, intentionality, and the philosophical conviction that each moment matters. It is a testament to human agency, reminding us that even amidst procedures, medications, and routines we cannot fully control, there remains space for conscious action, self-advocacy, and life-affirming decisions. In this light, the patient becomes a philosopher of their own health, weaving mindfulness, vigilance, and resilience into the fabric of every hospital interaction. This is the true inspiration behind the teachings of Dr. Mathew R. Weir, that informed, aware, and engaged patients can navigate uncertainty with courage, preserving not only their kidneys, but their sense of empowerment and dignity. As you move forward, remember that knowledge is not static, that vigilance is an ongoing practice, and that your choices ripple outward, shaping both immediate outcomes and long-term well-being. There is profound hope in this philosophy, hope that arises from understanding, from conscious action, and from the unwavering commitment to protect what is most essential. If you're benefiting from our topics, please subscribe, like, and turn on the bell notification so you can see our new videos early.